These are really tough times. We are going through so many exercises in trying to be aware and happy and sad and a lot of grief. If COVID-19 isn't enough, with the death of George Floyd just floods over, and so much sadness and grief. And how are you able in the world to deal with all of that? And someone very special might be able to help us. Her name is Asha Tarry, and author, award-winning community mental health advocate, psychotherapist, and a certified life coach. Asha, thank you so much for joining me.
Thank you so much for having me, Andy.
How in the world are you coaching people? Can we live and reconcile this grief and this anger and this sadness that we're going through right now?
Yeah, I mean, I'm actually doing a lot more therapy lately than coaching because people are grieving, and so that's what people need help processing. Most times it's not the first time that someone is grieved. It's usually triggered by another event, but this isn't an isolated incident in the world. This is on a continuum, the death of Black men, especially in public places by police officers, and it's just a hard thing to continue to witness and talk about and live through. So can we reconcile? I think mostly we need to accept that we are grieving. Grief doesn't have a timeline, and people have to experience what they will as they will and be with that and be okay with that. When people are able to and ready to integrate back into their lives, they will, because it's like anything else. When we need to separate or pause and take time out for ourselves, we do. And then we have to get back up and do the things that give us joy and pleasure, and also do the things that we're responsible to do.
It is difficult to get there. I mean, this the death of George Floyd is just one example, and it's one right after another, and yet nothing seems to get done. And this seemed to be, maybe this is the real catalyst that will then spur more action and to see some significant change.
Well, Andy, that's the hope. And I'm working with people every day to keep that hope alive, because without it, we do often feel despaired and we tend to become apathetic. And so I'm hoping that that does not happen, but really it's going to mean that everyone has to be actively involved in liberating ourselves and working towards more community developing and community relations and dismantling very oppressive systems that have been here since we've all arrived.
You can do that if you're healthy within yourself and your mindfulness. You talk about mindfulness as a holistic way of healing oneself on a continuous basis. Can you work us through what mindfulness is and the practice of mindfulness?
Yes, absolutely. So foremost, mindfulness is an ancient practice. It's been around for several thousands of years, and it actually came from the continent of Asia. But the most well-known figure who learned and brought it to the medical field was John Kabat-Zinn in the late 70s, while he was working on his residence doing medicine, and he saw there were so many patients who were severely mentally ill, but instead of doing the medical model of treating them with medication, he decided to integrate mindfulness and meditation to help people to heal themselves, and he saw dramatic difference and change in the way that they were able to function and recover from their illness. And so here we are in America practicing the moment-to-moment, non-judgmental awareness, which is what mindfulness is. In a way, it's meditating all day, but it's not sitting meditation. It's walking meditation. It's listening meditation. It's doing things with all five senses in the present moment without being critical of yourself, without judging what's happening, but just being a witness and noticing what's happening. And so my work as a mindfulness practitioner on myself and with my clients is to help us to be able to notice every second that is, instead of jumping to the future or living in the past, which is what most people deal with anxiety.
I see. Okay, so the rage that people feel, the anger, the sadness, whatever life is throwing at them right now, you're saying that you have to appreciate the present? Is that where you are? Is that what I'm thinking?
In a way, yes, but I want to open up space emotionally and mentally for everything that we notice, not only the feelings that might arise that could be uncomfortable, or on the opposite end of the spectrum that could be a positive feeling, but everything from sadness to angst to restless feelings in our body to ruminating thoughts to loss of lifestyle and that grief that comes along with that to more injustice to public murder. All of these different ways that we see things happening, hear things happening, and feel things happening, just being with those moments as they come and being gentle with ourselves to allow our bodies and our minds to try to adapt. And that may take time. And then also noticing what you may need in order to adjust. Like maybe you need to turn away from the news at times, or you need to disengage from conversations at times, or you need to sleep if you haven't been able to get sleep, or rest if you haven't been able to get rest. So as you notice yourself and notice what's happening, then you can gently give yourself the things that you need to be able to cope differently.
Okay. So you're going to coach someone in practicing mindfulness and how to, what are some of the ways that you could teach someone to start releasing those and relaxing?
Well, the first thing I tell people is the most inexpensive way you could heal yourself is to start with your breath. It's the one thing that for many, many years we've noticed in mental health and medicine has really helped people to recover from inflammation, from restless mood to stabilizing blood pressure, all of those different symptoms and signs that come along with illness and stress. So breathing from your diaphragm, Andy, as opposed to when we're stressed, we breathe from our chest.
Yeah.
We want to practice breathing from our diaphragm. Did you know that adults typically do not breathe properly and haven't breathed properly since they were infants?
Really?
Yeah. Just when you notice that if you lay an infant on their back and you watch how their belly rises and expands and they breathe in and out, that's exactly how adults should breathe. But as we become more active in our lives and we take on stress and our body tries to adapt to that, what happens is we breathe from our upper chest cavity and we elevate our shoulders. And so we carry a lot of burden on our neck, shoulders, and back, and our breath is typically very shallow. So as we learn to regulate better, we lower our shoulders, we sit more with our backs erect comfortably, and we open up our chest cavity and breathe from our diaphragm. And so that deep inhalation and longer exhalation is the thing that we start with in our work with mindfulness. And it's something that I often say, put one hand over your belly, one hand over your heart, and breathe from the area which you would push air into your lungs and then press it out through your mouth. And just see how your belly expands versus how your chest rises. Your chest shouldn't rise. Your belly should expand, and then it should cave in. It should expand, and it should cave in. So that practice of working with people really helps folks to get centered, grounded in our bodies, and that can continue to be a practice you could do before you're stressed. So when you're stressed, you do that.
I can see people listening to this right now doing that very thing because I am. I'm doing, as you're talking. Yes, exactly. I remember in college, my voice coach would say, you don't sing from the chest, you sing from the diaphragm. And,
that's right.
And take the deep breath and hold it. And you're right. It releases so much. It's amazing.
It is. It's beautiful.
Once I've worked through the breathing exercise and I'm starting to relax a little bit, and especially in my shoulders, then what's next? How do I get there?
Then I say to people, identify 5 things in your environment, in your immediate environment that you see. And this technique we call in mindfulness the 5-4-3-2-1 technique. It helps to ground us. So when we feel off-centered or off-balance, we look for 5 things in our environment that we can name and label. Then we look for 4 things that we can hear, 3 things that we can touch or feel, 2 things that we can smell, and 1 thing we can taste. And this technique can be done within less than a couple of minutes, and it helps to center us so that we can be present to what's happening in the now. When we do that, all kinds of things come up for people. Oh, I didn't notice, this glass jar sitting next to me, or I didn't notice I heard birds chirping outside my window, or I could hear my stomach growling, or any of those numbers of things. And so when we work through the present moment awareness, it helps to center us, and we can use our wise mind then to make decisions for us in a more responsible way instead of a more reactive way.
Okay, I'm beginning to see that, because there are many times in our lives when we suddenly notice something, an object or an event or whatever that you didn't notice before. I didn't even know that was there.
That's right.
I've driven by it a million times. I never saw it before. So, in
Yes,
other words,
exactly.
start to be aware.
Start to work on awareness, seeing, listening, tuning in. How many times do we have conversations with people and we don't know what we heard when the conversation ends
Right.
because we were caught up in our thoughts or we were working on what to say? Being present to listening, being an active listener is a skill. So tuning in and paying attention to what we are hearing. What I do with some of the clients I do coach through relationship coaching is I say, when you go out on a date, I want you to really narrow in on one part of the conversation that you can remember. And when you leave the date, just jot down 3 or 4 things that you recall that person telling you. Don't describe it in detail, just what did you hear as much as you can remember verbatim. Write those thoughts down and remember to share them in our next appointment so that we could talk about actively listening, tuning in. And it's really amazing when they come back and they're like, I didn't notice that I normally don't listen very well because I was very focused on what this person was saying at this, point when I was at dinner. And I said, yeah, that happens all the time. And so then we get trapped in our thinking, and then our thinking dictates what we feel, and then our feelings dictate how we behave. So mindfulness-based cognitive behavioral therapy, which is what I do, helps people to get more centered, to make more wise decisions instead of being more reactive based on their emotions. And when I coach people through how to do these steps, we'll practice it in real time, and I'll have them identify those things in the environment, and then we'll walk through them together.
How many times in a conversation have we said to the other person, "What did you say again?"
Yeah,
It's
exactly.
they spaced out, they've zoned out, they were distracted by something. Listening is a huge part of that. That's fantastic. But then, what about yourself? I mean, you're practicing this breathing, and you're learning to listen and to notice things more. But you have to like yourself, don't you?
We would like that. I think that's the goal that most people strive for, but it's hard. As often as we hear the catchphrase self-care, we don't hear self-like. We hear self-love a lot. We don't hear
Mm-hmm.
self-like.
Right.
And I often say to people, let's start with liking ourselves. What would that look like? What would you do for yourself if you befriended yourself? What ways would you treat you? And it's an
Uh-huh.
interesting way of asking this question because it gives us pause, typically because we're not often thinking about ourselves in a compassionate way. We're thinking about the things we don't like about ourselves. We're thinking about the things that were done to us. We're thinking about the things we should have done differently. So we're not, again, in the moment. So what I help people to do is to find ways of liking themselves, learn things about you that you really appreciate, learn what you're good at, be patient with yourself if you want to learn something new and work on mastering that. But it's almost like traveling back to your childhood. If you were to parent yourself and say, work on this one thing that you want to improve upon, or tell me who you are, what would you say about yourself? So, yeah, I think we should work on being able to like ourselves first and practice that, and being kind and find things about ourselves that we appreciate so that we can then be kinder to other people.